recently moved from the UK to Canada. I'm Canadian, but I've lived in the UK for 23 years. So I'm still getting used to it. I thought it would be interesting to talk about the differences between the UK healthcare system and the Canadian healthcare system as a person with ME, the illness also known as ME/CFS or chronic fatigue syndrome. So, differences between the two healthcare systems. The biggest difference, the huge, crazy difference, the one I couldn't wrap my mind around, in Canada there is no private healthcare. No, it doesn't exist. It can't exist. It's illegal. So in Canada, it's just the government system. It's illegal for a doctor to practice privately or a nurse to practice privately. Now, if you don't have entitlement to the Canadian system, then you can still go to the doctor. Like I'm still not on the system yet. It takes a few months to get on the system. So I had to pay. You can go to the doctor and pay money if you're not Canadian or if you've recently got here or if you've moved from one province to the other. You can pay money, but you're seeing the same doctor that everyone else sees. There's no such thing as a private doctor, private hospital, private clinic. Those don't exist. The philosophical reason behind that is so that there's just one healthcare system. There isn't a different system for the rich and the poor. And I love that idea. But the Canadian system is not perfect. The first thing I was worried about when I arrived in Canada was, would I be able to get my medications? In the UK, I was taking several medications which were prescribed to me for my ME/CFS. And they're off-label drugs, so I was worried about that. In the end, it was not a problem. The GP who I saw did kind of question it a bit. He said, "Oh, this dosage seems a little high. Did your doctor in the UK talk to you about it?" But because I had medical letters from doctors in the UK, he seemed fine with that. He was happy to just prescribe me the same drugs that had been prescribed to me by UK doctors. So that was fine. Another thing I wondered about was what would be the general level of knowledge of doctors. In the UK, most doctors don't know anything about ME/CFS, and they can be very ignorant. It's not just that they don't know, it's that they think they know, and they are dead wrong, which is challenging for patients. Based on the one GP I saw here, it's exactly the same here. This GP, when I said I had ME/CFS, now he wasn't mean or unkind or even dismissive. But what did happen is he said, "Oh, there's a specialist service I could try to refer you to." And he listed a service, and I said, "Oh, that's not what I was expecting to hear. I've done some research. I was expecting this other service called the Complex Chronic Illnesses Service." So I later looked up the service that the GP wanted to refer me to, and it was a wellness service. It was a sort of like think happy thoughts and do yoga and have good nutrition kind of service. So he had wanted to refer me to a non-medical service, which I suspect is intended for people who, when the doctor thinks there's nothing to be done for you. Well, I don't even know what this doctor was thinking. I mean, I'm really surprised that a service like that actually exists, because it's just like wellness. It's really like think positively and have good nutrition, which is great for everyone, I suppose. It also has a waiting list in the years, so I think the real purpose of it is to fob people off. Anyway, so I do think this doctor was very clueless about ME/CFS. I called it ME/CFS when I spoke to him, but he said, "ME/CFS, what's that?" I said, "myalgic encephalomyelitis, chronic fatigue syndrome." And he said, "Oh, chronic fatigue syndrome." And then he called it chronic fatigue syndrome for the rest of the session. On the other hand, so I do think this doctor was completely ignorant. But on the other hand, I told him, here's the one service I think I should have. It's this complex chronic illnesses service at this hospital. And he did refer me. so that once I get on the system here, I will be able to be referred to the right service, which is great. And that brings me on to kind of the most, I think, mind-blowing thing for people with ME. Here in British Columbia, I don't think it's the same everywhere in Canada, but here in British Columbia, they do have a specialist service for people with ME/CFS, long COVID, and related illnesses. They call it complex chronic illnesses. And it prescribes medication. I mean, that's crazy, right? In the UK, if you want medications for ME/CFS, you have to do it privately. And the doctors who are experts in ME/CFS, in the UK, those doctors, they have to work privately. They can't work with the NHS. They're not private because they want to have wealthy clients and make a lot of money. They work privately because the NHS will not allow them to provide medical care to people with ME/CFS. So in the UK, there is a small number of these really sort of heroic doctors who just are very, very knowledgeable. They're true experts. They go above and beyond for their patients, and they have really, really long waiting lists. So it turns out here within the Canadian system, you know, when I heard that there's nothing private, I thought I like that idea in general, but for someone with ME/CFS, that might be really, really bad. But it turns out there is a service here. Now I'm going to have to wait 3 months to get on the system, and then after that wait another 8 to 11 months to be able to be seen by these specialist doctors here, because they have wait lists. It's not perfect here. On the other hand, this service that I'm referred to, they have a website that gives a lot of information. They make videos and things like that, and they talk about what things they offer, and they really offer medical treatment for ME/CFS. You can get LDN. There's a list of other drugs that they can prescribe people. So I'm quite excited by that, even though the wait list is long. They have not just LDN, they have other drugs that they try with people, and I'm excited that at some point I might actually have the opportunity to try some more medications that might possibly improve my health. That's completely amazing. Another interesting difference. In the UK, ME/CFS and POTS are just two separate illnesses. They're comorbidities. In Canada, POTS is a symptom of ME/CFS. It's not a comorbidity, it's a symptom. And that has some interesting consequences, because in the UK, I could not access an ME/CFS specialist through the NHS, but I could access a POTS specialist through the NHS. But it was so difficult. It was so difficult trying to talk to this doctor, because I'm talking to a doctor who knows all about POTS and nothing about ME/CFS, and she believed that ME/CFS was deconditioning. And I kept explaining about post-exertional malaise, and she kept telling me that I have to do graded exercise, and I kept telling her, yeah, that's not good. And she said, well, no, graded exercise is always good. And like, she was, you know, she wasn't a bad person. She was sincere. She wanted to help. Oh my God, it was a nightmare. So I actually think it's brilliant that in Canada they treat POTS as part of ME/CFS rather than separate, because that just means the same doctor that's helping you with your ME/CFS is also helping you with your POTS, which makes so much more sense, because the two interact a lot. So that's it. That's really all that I've learned about the Canadian system so far. Maybe I'll make another video once I've learned more, maybe when I've actually gone to this complex chronic illnesses service and found out what it's really like. Okay, thanks for watching.